Good day, everyone. Hello, I'm Dr. Hatta, one of the IVF consultant and fertility specialist here at Sabah Care Fertility Center in Kota Kinabalu. Together with me is Dr. Cheong. Hello, Dr. Cheong. How are you?
Hello, I'm fine. I'm Dr. Cheong from Sabah Care.
Yes, today we will be talking about how to improve your stimulation in an IVF cycle. So we have devised it and we found out there are 6 tips that you can do to improve your stimulation when you start your IVF cycle with us. Firstly, Dr. Chong, if I'm not mistaken, it involves certain injections, isn't it, of drugs. Can you explain to us what does it involve?
Yes, we do need injection in the stimulation part of IVF. The hormone that we are injecting is called FSH, or follicle stimulating hormone, which means a hormone to stimulate the growth of the follicle. And follicle is this fluid-filled structure that carries the egg. So basically, is to help the egg to grow.
Many people ask Dr. Chong, does this involve the needle? And how big is the needle? And how many times does that patient needs to inject herself?
Don't worry, the needle is very small and fine, and the average duration is about 10 to 12 days. It's very easy, and usually it can be done by self-administering on the tummy fat. So it's very easy.
Meaning the patient can inject it herself without any assistance from anyone.
You are right. But of course, our nurse will have a training session first. I would say almost all can do it themselves. And it is meant for self-injection. So you don't have to worry about wrongly inject and problems like that.
And I'm sure we will teach you how to adjust the dose as we go along for the injections, isn't it?
Yes, the dosage is very important. And normally the doctor will decide how much you need, whether you need a lot or just normal dosage. And this is something that you should not make mistake. So one of the tips involving injecting the correct dosage that you are asked to do.
So tip number 1, correct dosage and follow your dosage. Number 2, how do we monitor whether the injections, the dosage for the injections is sufficient or enough to stimulate the ovaries? What do we do?
Usually, we have to do a transvaginal ultrasound scan to monitor the growth of the follicle. And sometimes, if we feel that the dosage is not sufficient, whereby the follicle grows too slowly, we may want to top up the dosage or otherwise. So we do the ultrasound scan to monitor all this.
So that means you need to insert a probe through the vagina. Can it be done from the abdomen, from the top, the tummy?
Preferably, it is a transvaginal ultrasound scan because they will give us a very clear view of the follicle. So I would say we still stick to the transvaginal way.
And it's painless, isn't it? It's painless. They don't have to
Of
worry about.
course.
Yeah.
No, don't worry.
So tip number 2, come for your transvaginal scan. And you may need to come more than once, isn't it? Maybe twice or sometimes 3 times. It depends.
Yes, yes.
All right. Number 3, what are the things that you have to look out for, watch out for when you start stimulating for the ovaries for IVF?
Yes. Firstly, of course, don't make mistake on the dosage, right? And secondly, you must take care of your medicine because it has to be kept at cold chain, meaning it should be kept in the fridge, not freezer. Yeah, it's fridge. And some people, they forgot to put it back after they use it. So when the medicine gets too hot, it may get spoiled. So please remember to put it back into the fridge after finishing injecting it. Other tips that I will give to my patient is maybe during that period, don't consume any other drugs or even supplements that has hormonal content because the two hormones might fight with each other. So keep it simple, just the normal vitamins and your FSH injection.
So tip number 3, it needs cold chain. That is also why when you come and see the doctor, please do not forget your cooler box. Yes, we'll put ice in the cooler box, so when you want to transport the injections from the clinic back to your house, it is maintained, the coldness is maintained in the cold chain. And again, do not put it in the freezer or it will freeze, right? It will freeze. So please put it at the fridge, the one below, okay? But do not confuse it with your vegetables. Now, the thing that Dr. Cheong did mention was, besides cold chain, is herbs. People do ask us whether they can take anything extra to help the stimulation, but it is not advisable. So please refrain from taking anything like herbs or any traditional medications while you are doing your stimulation. And then, Dr. Cheong, after that, if all is followed, done and well, it comes to the day where we need to do the ovum pickup or OPU. What are the things that the patient should know before going for an OPU?
A few things, including the most important one is a very important injection called HCG. It has to be given at a very accurate timing of around 36 hours. Why I say around? So we have 1 hour allowance, maybe 35 to 37. But if can, we stick to 36 hours before the procedure of ovum pickup. So that's number one. Very important not to, again, make mistake on this injection time. And secondly, is because the procedure needs to be done under very mild anesthesia. So you need to be fasted for around 8 hours before you come to the center for the procedure. And lastly, the husband also needs some preparation. Normally, we will need him to have 3 days sexual abstinence before the procedure, meaning no ejaculation for 3 days, so that we can ensure that the sperm produced on that day is at its best.
So tip number 5 is get your HCG timing correct, because we have had patients with she forgot to inject her HCG. We were unable to obtain any eggs from her. And last tip is tip number 6 was please refrain from ejaculating your sperm or the husband's sperm before the date that we do the OPU. So these are the 6 tips that we have laid out for you. And with these tips, we hope that once you follow them, we hope that you will have a successful stimulation. Okay, thank you very much, Dr. Cheong. So
Thank you,
everybody,
Dr. Hatta.
thank you. We'll see you again on our next session. So for now, I say goodbye.
Bye, everybody.